What is bile, which is also called bawaseer in Urdu and Hindi? Piles are also known as hemorrhoids, are swollen veins in the lower rectum and anus. Hemorrhoids can occur inside the rectum, internal hemorrhoids, or outside the anus, external hemorrhoids. Hemorrhoids are common condition and many people experience them at some point in their lives. Factors that can contribute to develop hemorrhoids including straining during bowel movements, chronic constipations or diarrhea, pregnancy, and sitting for a long periods of time. Symptoms of hemorrhoids can include itching or irritation in the anal area, pain or discomfort during bowel movements, bright red blood on the toilet paper or in the toilet bowl after a bowel movement, leakage of feces. Medications used for piles. There are several over the counter medications that can be used to relieve the symptoms of piles, including number 1, topical creams or ointments containing hydrocortisone, which can help reduce itching and inflammations. Witch hazel pads or creams, which can help soothe the area and reduce swelling. Stool softeners, which can help to prevent constipation and reduce straining during bowel movements. Oral pain relievers, such as acetaminophen or ibuprofen, to help reduce pain and discomfort. In addition to medication, there are several self care measures that can help relieve the symptoms of piles, including increasing fiber intake to soften stools and reduce constipation, drinking plenty of fluids to help prevent dehydrations, taking warm baths, or using seize baths to soothe the area and reduce inflammations, applying ice packs to the area to reduce swelling and discomfort. If self care measures and over the counter medication don't provide relief, or if symptoms are severe, a doctor may recommend additional treatment options such as rubber band ligations, sclerotherapy, or surgery to remove or shrink the hemorrhoids.